Hello everyone, welcome back to our channel Exam Key Point Dentistry. Today we are going to learn an important orthodontic topic, space maintainer. This topic is very important for BDS exam, Viva question, clinical understanding. So before starting, let me ask you one question. What happens if a primary tooth loss too early? Yes, the adjacent teeth start moving into that empty space and later permanent teeth may not erupt properly. So that is why we use a space maintainer. So let's start this topic in very easy language. So, a space maintainer is an orthodontic appliance which is used mainly in children when a milk tooth is lost early. So, its main job is simple, that is the save the space for the permanent teeth. So, we will see first definition. So, definition of space maintainer here is it is a fixed or the removable appliance which is placed to maintain the space which is created by the premature loss of a tooth or a teeth. So here fixed appliance means the patient cannot remove it and removable appliance means the patient can remove it. Okay, so premature loss means here the milk tooth lost earlier than the normal time. So basically space maintainer prevent neighboring teeth from shifting. Okay, so if space is not maintained, so what problem can occur? Crowding, malocclusal, impaction, aesthetic problems. Very good. So now we see why do we do space maintainer? So here the space of prematurely lost teeth usually change in the following 6 months period. That means the nearby teeth start drifting, space becomes smaller and permanent tooth may not adhere properly. So this can lead to the crowding of the permanent dentition, impaction of the permanent teeth, aesthetic difficulties, malocclusal and other problems. Okay. Now we see the indication of the space maintainer. So if the space shows sign of closing, if it means if teeth are moving into that empty space, so we use space maintainer. Second one is if the use of space maintainer will make the future orthodontic less complicated. So if we maintain space early, braces treatment later becomes simpler. Third one is for the malocclusal treatment. Fourth one is when the space should be maintained for 2 years or more. So sometimes permanent teeth eruptions take time, so we maintain space for longer duration. To avoid supra-eruption of the opposing teeth. So it means if one tooth is missing, an opposite tooth may erupt more downward or upward. So this is called supra-eruption. So here we need space maintainer. Now we see the contraindication of the space maintainer. So when should we not use space maintainer? So here if the radiograph show the successed tooth will erupt soon. So here no need to place the appliance because the tooth will erupt naturally. Okay. Now if the radiograph show the 1/3 of the root is of already calcified. So here the permanent tooth eruption is near. Now when the space left is greater than the needed for the permanent as indicated from the radiographically. So here there is no risk of space closure. Okay. Now if the space show no sign of closing, again no need for appliance, and when the succeeded tooth is absent. So if permanent tooth itself is missing, the treatment plan will change. Okay. So now we see the features considered for the space maintainer. So first one is time lapse after the tooth loss, which is stand by the McDonald and Enbury. So that if the space closure is going to occur, so it will usually take place within the 6 months after the loss of tooth. So according to him, maximum space closure happen in first 6 months. So appliance should be placed as early as possible. Okay. So which period show maximum space loss after extraction? That is the first 6 months. So very important Viva question. Now the more factor is therefore appliance must be placed as soon as possible following the extraction of the tooth. Okay. Now the next feature is amount of space loss. So here the maxillary space close faster as compared to the mandibular space. Third one is rate of space closure. So younger the patient, more is the space loss. So maximum space is lost during the first 6 months of extraction. So younger patient having the more space loss. Okay. Now direction of the space closure. So teeth can move mesially, distally, or either it can be tilt. Okay. Now eruption status of the adjacent teeth. So it helps in certain. So this affecting the movement of the nearby tooth. So here example is mesial shift of the molar and the distal tipping of the canine. Okay. Now the next feature is the amount of the bone coverage over the tooth. So according to the McDonald, 1 mm of the bone resolve in 4 to 5 months, and if 1 mm or more bone is overlying the succeeding teeth, so it is an indication for the space closure. So here according to the McDonald, if 1 mm bone is present, so it can already resolve in 4 to 5 months. So if more bone covers the permanent need, so here you see if this is more bone which is the more than 1 mm, so it will, here there is higher chances of the space closure. Okay, so here we need the space maintainer. Okay, now the next is dental age of the patient. So we always check the child dental age and which tooth will erupt next. Next one is sequence of the eruption. Okay, now delay eruption of the permanent teeth, that is a congenital absence of the permanent teeth. Okay, now we see the classification. So first, based on the placement. So based on the placement, so first here is unilateral space maintainer. So here it maintains the space on one side of the arch. Okay, used only on the one side of the arch. Example is band and loop and still shoes appliance. So here the band and loop, which is band is placed on the adjacent tooth and the loop is maintaining the empty space. So very common appliance in the pediatric dentistry. Okay. Second one is distal shoes appliance. So it is used when the second primary molar, you see second primary molar is lost before the eruption of the first permanent molar. So this guide the permanent molar eruption. Okay, so this is a distal shoe. This is a distal shoe appliance. Now based on the placement, that is a bilateral space maintainer. So here it maintains the space on the both side of the arch. Example is lingual holding arch and the Nance palatal arch. So lingual holding arch, which is seen in mandible. So here the wire runs along the lingual side and it maintains the lower arch space. Now the second one is Nance palatal arch, which is seen in the maxillary. Here the acrylic button rests on the palate, which is prevent the molar the movement. Okay. Now based on the duration of the use, so first one is fixed appliance. So here it is cemented or otherwise fixed into the tooth. Patient cannot remove it, so cannot remove by the patient. Example is band and loop, distal shoe, lingual holding arch and the Nance palatal arch. So which type depend less on patient cooperation, fixed or removal? That is a fixed appliance. Excellent. Okay. Now based on the duration of the use, it's also divided into removal appliance. Okay, so you already see fixed. Now we see removable space maintainer. So patient can remove these appliance. Okay, so it is made up of the acrylic or the wire appliance that patient cannot remove. So example is Holly's appliance with a pontic, removable lingual arch and the acrylic partial denture. So you can see acrylic base plate with a wire. This is an acrylic base plate with a wire. So it helps maintain the space and sometimes improve aesthetic too. Okay. Now we see the non-functional space, that is based on the functional design. Here the non-functional space here means it only maintains the space. There is no mastication or aesthetic provided. Example is a band and loop and the distal shoe. Now based on functional design, it also divided into functional space. So here it maintains the space plus restore the some function or aesthetic. Example is a Grobber appliance for the anterior aesthetic and the removal functional partial denture. So here in diagram show the appliance, show the replace the posterior missing teeth. So here the child can smile confidently and speak properly. Okay. Now based on the arch involved, it is divided into two, that is a maxillary space maintainer and the mandibular space maintainer. So maxillary space maintainer are the Nance palatal arch and the Grobber appliance, while the mandibular space maintainer are lingual holding arch, band and loop and distal shoe. Okay. So quick revision, space maintainer prevents space loss after the early tooth loss. Maximum space loss occur in first 6 months. Type is unilateral, bilateral, fixed, removal, functional and non-functional. So friend, this was a complete easy explanation of space maintainer. If you found this video helpful, then like, share and subscribe to our channel and comment below which orthodontic topic should I explain next. So thank you so much.